The Canadian Pain Task Force has issued its first report. And you know, we've talked a great deal about chronic pain on this program and how it specifically affects people who have just horrible lives because they're overwhelmed with 24/7 agony. And we've heard people on the air crying. We've heard people on the air talk about suicide because they have been forcibly tapered or their medications, their opiates, have been just removed by doctors. I've talked to doctors who told me that they don't want to prescribe opiates because they're afraid they'll lose their licenses, or the colleges of physicians and surgeons in their province may take their licenses to practice medicine away. Maria Hudsmith is the co-chair of the Canadian Pain Task Force. She's also the executive director of Pain BC. Ms. Hudspith, thank you very much for joining us.
Great to be with you, Roy. Thanks for having me.
This is such an incredibly important issue because it affects millions of people, literally.
Absolutely. 1 in 5 Canadians.
So let's talk about, I just looked at I wish we had more time, but it's one of those days. But I looked at your some of the highlights. There's a global consensus that chronic pain is a significant chronic disease in its own right, and as such needs concerted attention. This is not reflected in the current state in Canada. Care for chronic pain is largely dependent on where people live and what type of insurance coverage they have. And then I look at another point. Efforts to reduce the number of opioid-related overdose deaths in Canada have had significant consequences on chronic pain patients, including increased stigma and reduced access to treatment. For some patients, it's also resulted in inappropriate prescribing practices, such as abrupt stoppage of opioids or tapering without consideration of the risks associated with withdrawal or the medical needs of patients. Could you please address that?
Sure. So I think what we've seen over the last number of years in Canada is a growing concern around opioids and a growing response to what many people refer to as the opioid crisis. And I think everyone is now recognizing that while there were well-intentioned efforts to address the harms of opioids for some people, the pendulum has swung way too far. And we've seen negative effects on Canadians who live with pain, who are now living with more pain and suffering as a result of well-intentioned public policy. And this report is certainly naming that issue.
So patients are suffering because they were prescribed opiates? Is it because you're saying because it was too liberally prescribed? Or I mean, because I talk to the people on the other side of the spectrum who say that I'm being forcibly tapered by my doctor, or I've been refused my opiate prescriptions to be continued, which I arranged in consultation with my doctor because my doctor's now scared of the College of Physicians and Surgeons.
Absolutely. And Roy, you and I are on the same page on that one. We're talking about the harms from this pendulum swing to very restrictive, kind of one-size-fits-all model of prescribing. So I'm not talking right now about the harms of opioids broadly. I'm talking about the harms of people who may be being forcibly tapered, taper too rapidly, cut off their medications, or even what we're seeing in some cases where people have been prescribed opioids for pain from a physician. That physician retires, that physician moves, and we're seeing really discrimination against those patients where other physicians are unwilling to take on that patient because they have already been.
So let me ask you this. Why not issue a clear and public directive to Canadian doctors to end forced tapering and to end stoppage of the long-in-place prescribing of opiates like morphine, prescribing that was arrived at between the patient and the doctor? Why not just send out a clear and public directive? Health Canada can do that.
You know, I think I'm going to talk a little bit about the experience in BC that we've seen. You know, we've been working very actively through our organization, Pain BC, with our college there, and really through a concerted effort, the college in BC issued changes to the standard. So this is a legally binding standard we have in British Columbia, and that standard now says you cannot discriminate against people because they're on opioids. You cannot discriminate against people because they have chronic pain. What we're not seeing is that the practice is changing as a result of that standard. So I'm very skeptical about directives being issued and them having an effect on practice. We're seeing, even in the United States, the Centers for Disease Control, which issued the first guideline in 2016 that many other guidelines have subsequently been modeled after, they have now issued something saying, our policy or our guideline has been misapplied, and we're not seeing or hearing about the corresponding change in practice. We all know the health system is very complex. There are lots of different people and organizations, who have a role to play. And where we have seen a change in standards to address exactly what you are saying, we have not seen a corresponding change in practice. So I think that's the issue, is what is it going to take to shift that practice? And my view is it's not just going to be a directive from the health minister. It's going to be a whole bunch of concerted effort.
Right. Well, without a directive, that should be step one. And without a directive, it's not going to change. I feel, because I've talked to so many doctors, and I mean that over the last 3 years. I've talked to many doctors who've told me they're afraid. They're afraid they'll lose their licenses. Let me just read you something by Thomas Klein, probably familiar with the name. American doctor, PhD. He's very active on the social media scene with for pain patients from a practicing physician standpoint. It's bad out there, very bad. In my 40 years, I've never seen nor imagined the magnitude of such a gross error in medical judgment. Worse, it developed under our noses and then ignored as an inconvenient truth. Until disproven, it looks like 5 to 7 million lives have been ruined, not to mention lives ended over the past 3 years. So that's one doctor. And I want to just raise this point with you as well. When we talk about people who are victims of opioid overdose, there's quite often, as part of the argument or part of the numbers, included in the numbers are opioid or at least drug addicts. And I'm not talking down to them. I'm just saying people who have an addiction to drugs and buy illegal drugs or drugs that have been sold without proper ethical consideration to drug dealers. But you have people who are drug addicts who are dying of opioid overdoses, and the patients are the ones who suffer because of this. Am I wrong?
You're saying that people who live with chronic pain are suffering as a result of the overdose crisis?
Yes.
Yes, I absolutely...
Because I'm talking about drug addicts who die. I mean, people who are addicted to drugs, who buy drugs from drug dealers, die of opioid overdoses. But then it's transferred to the pain patient. It becomes part of the pain patient's picture.
Yes, and Roy, I absolutely agree with you that people who are living with chronic pain are being negatively impacted, because I think people misunderstand the distinction between opioids for medical purposes and illicit opioids, and people get those things mixed up. So absolutely, people who live with pain are being further stigmatized as a result of sort of the public thinking related to the overdose crisis. I think one of the things that's important to note is many people who live with substance use disorder also have chronic pain. And so we're concerned about everybody who has untreated chronic pain. We're concerned about people who have chronic pain without a substance use disorder, and also concerned for people who have chronic pain and a substance use disorder. But I think the thing that I really hear from people who have been living with pain long term, who do not have an addiction, that they are really suffering as a result of the change in this climate. I know you're talking to Angus Reid later today. We just concluded a poll with the Angus Reid Institute looking at pain in Canada, and you profiled it on your show. But what we heard in that poll, 37% of people living with pain who were polled said they could no longer get access to their medication. Mm-hmm. And that is absolutely...
I spoke with Angus Reid's representative, Dave Korsinski, about that poll yesterday. I just want to read this to you. This is from a pain patient. I would rather be addicted than the horrors I'm experiencing off my meds.
We see, well, I think we're hoping to see change from this directive the CDC issued in the U.S. Uh-huh. I'm a bit skeptical that we will, but we're sure hoping so.
Okay, so let's you and I talk again, Ms. Hudspith, and maybe we'll set aside more time where we can get into this issue in a more broad approach and look at the component parts, as you also found in that Angus Reid poll. But I appreciate you joining us on the air today.
Happy to be with you and look forward to another opportunity.
Thank you so much. Maria Hudspith is the co-chair of the Canadian Pain Task Force. Looking at something online here, this is a doctor's office. In order to comply with American doctor's office, in order to comply with new CDC guidelines, this office will no longer be starting patients on chronic opiate therapy if you're currently on chronic opiates, Norco, Percocet, oxycodone, etc. We will begin weaning and tapering doses in upcoming visits. We will continue to provide medical care for chronic and new medical conditions. Please discuss any concerns with your physician. Doesn't sound like there's much to discuss. Barry Ulmer is the executive director of the Canadian Chronic Pain Association. He joins us, talked to Barry many times on this program, as we have with Marvin Ross, medical writer for HuffPost Canada, patient advocate. We've talked to, as I said, Marvin many times. He joins us as well. Barry, what's your response to the Pain Task Force?
Well, Roy, I guess I'm a bit disappointed as I was in the announcement of in the first place. However, what I did like was the fact that they did finally acknowledge that chronic pain is a problem. But I was kind of disappointed in Maria's comments to you, saying now when you asked her, well, why doesn't the minister come out and make a definite statement? I mean, and then blamed it on the fact that things in the United States aren't changing. Well, of course things aren't changing because politicians like the minister will not come out and make that definitive statement that doctors have to start treating patients properly, and specifically say that the colleges of physicians and surgeons must stop going after them the way they have been. And of course, nothing will ever change unless a politician in the position of the minister comes out and specifically says that. So in effect, to us, they've just wasted the last 4, 5, 6 months by coming out with stuff that we've known for years. It's out there. You don't need to put together a task force to come up with stuff that's even based still on some erroneous studies. But at least they recognize chronic pain is a problem.
Marvin, every day, additional people, human beings, are being added to the roster of chronic pain patients who are involuntarily consigned to agony.
Right. And I get calls from people all the time.
I know you do.
As does Barry.
So, your thoughts?
Well, I'd like to step back just a bit, and the reason for a task force. And it's well known that when governments don't want to do something, or they don't know what to do, they set up a task force. And then they can say, well, the reason we're not doing anything is that we have a task force studying this problem, and we have to wait until the final report comes in 3 years' time, which, frankly, is a crock. And Maria's explanation is downright insulting, that the minister can't issue a directive. Of course the minister can issue a directive, because what is happening to pain patients is a violation of the Canada Health Act, in my opinion. Everybody in Canada is entitled, regardless of money or any other condition, to equal medical care, and chronic pain patients are not getting that care.
They do point that out in the report.
Yeah, but they don't offer a solution.
No, look, the solution, gentlemen, as all three of us know, and I'm sure Ms. Hudspith knows, and everybody knows, is to provide the patients what they require to resolve their issues and not put them in a position where they're living in agony and cannot perform the most simple of daily tasks, which we all take for granted. We're going to have to. We only have a minute. I squeezed everything in I could today. Barry, what's the website for your group? Tell us again, please.
It's www.chronicpaincanada.
Okay, Chronic Pain Canada. Final thoughts, Barry? Give me yours.
I think people don't have 3 years to wait, Ray. I mean, it's the suffering out there, as you know, you hear it every day.
I do.
Is just out of whack, and the minister has to come back and make a definitive statement. And when guys like Dr. Klein come out and make the statement that he has made, the worst he's seen in 40 years, that tells you something right there.
Okay. 20 seconds, Marvin.
Frankly, this is a violation of the Declaration of Helsinki ethical principles that was signed by all countries involved with the World Medical Association.
Okay.
In that you must not do harm to your patients.
Sounds like the Hippocratic Oath to me.
Yeah, well, this is, a legal document all countries signed as a result of what happened in concentration camps.
Okay, I have to go. Marvin, thank you very much. Marvin Ross and Barry Ulmer, and chronicpaincanada.com is the webpage.